Hello and welcome to Lunchtime Politics on Channels Television. I'm Millicent Onwaka. On the news this hour, the federal government steps up efforts to contain spread of coronavirus in Nigeria as it mounts up screening, testing, distribution of preventive kits and awareness of the dreaded virus. Court adjourns hearing of the Imo Zamfara governorship judgment till tomorrow, March the 3rd. Gombe State Governor raises the red flag of the potential danger in the Algeria system as he calls attention of Nigerian leaders to what he describes as potential security risks. Thanks everyone. Welcome to the program. Well, we begin today from Abuja, Nigeria's federal capital territory, where a public hearing was organized highlighting the federal government's efforts at containing the spread of the deadly coronavirus. And indeed, the Minister of Health, Dr. Sage Hanire, led the federal government's delegation, where he assured Nigerians that the federal government is on top of the situation and that there is no cause for panic. The health minister also disclosed that contacts have been traced to both Lagos and Abuja, while also explaining that the coronavirus patient is responding positively to treatment.
He was admitted with symptoms at the infectious disease hospital in Yaba, Lagos, and he is clinically stable. His symptoms are very mild. Since the confirmation, we are focused on containment, including contact tracing, risk communication, and management of the case. As at the 1st of March, there is no new confirmed case in Nigeria. About 13 or 14 tests have been done, and except that one patient, no other person has been diagnosed. Currently, the contacts of the index case are identified as 19 contacts in Lagos, 39 contacts in Ogun State. We are in touch with these contacts who are under supervised self-isolation, and the states have provided them with temperature monitoring tools. We have also deployed National Rapid Response Teams from NCDC who are working closely with all the states. Over the past 2 days, NCDC has updated the guidelines for health workers, an advisory for the public, and also has shared this widely. It is important for all Nigerians to focus on the facts and not on fear, and not to generate panic.
That's earlier today. In the meantime, the Lagos State Governor, Babajide Sanwo-Olu, was on our Sunday Politics program where he assured Lagosians that the state government is mounting heavily surveillance and prevention measures to ensure Lagosians are safe from the deadly virus. Mr. Sanwo-Olu also assured that the testing centers at Yaba in Lagos is well equipped to handle any emergency case of the coronavirus, as he also gave out emergency numbers to call.
Whilst the incident case where the patient first would be tested was like in a holding bay, it's only when you turn positive, right, that they will now put you to the main quarantine facility. So there was a holding bay before you now move into the main quarantine facility. So the two places also have been well put together.
In the meantime, Nigeria's president says he is concerned about the confirmation of a case of coronavirus in Lagos. President Muhammadu Buhari's worry was contained in a statement where he asked Nigerians not to panic but to strictly observe the advisories disseminated by the Ministry of Health, the Nigeria Center for Disease Control (NCDC), and the World Health Organization (WHO) on the best ways to prevent the spread of the infection. The president, however, commends the Federal Ministry of Health and other relevant agencies whose diligence and efficiency, he says, enabled the case to be detected, diagnosed and isolated quickly, even while swift measures were taken to identify and follow up on those with whom the index patient came into contact. He also commended the responses of the Federal Ministry of Health and governments of Lagos and Ogun states, as well as other relevant agencies, to the reported incident and calls for vigilance on the part of all citizens and also responsible government agencies. Expand the issue still more on containing the spread of the coronavirus. How prepared are the gatekeepers of Nigeria's health sector in containing the spread and also other future emergencies? Senate Committee Chairman on Health, Dr. Ibrahim Oloriegbe, joins us now via Abuja studios. I'd like to thank you, Senator, for joining us at this time. I'd like to quickly get your brief assessment of the measures taken so far in Lagos, Ogun, and also the Federal Ministry of Health on this virus.
Oh, thank you very much. My pleasure to be here this afternoon. Just like the minister said, I'm also part of the stakeholder that is provided update brief. I've received the situation report as of today from the Nigeria Center for Disease Control. As the minister stated, all the contacts that the index case has had since he came to Nigeria have been traced, and they are under quarantine, as he said, just to be able to monitor them. So far in Nigeria, we've had 13 samples tested, and only that index case has proved to be positive. As the minister also said, all the fear that were raised from Plateau, none of the persons has tested positive. They are all negative. So I think as Senate, as National Assembly, who oversight on the health sector, we have been constantly in touch with the Federal Ministry of Health and all the relevant agencies. Before now, if you have followed our activities, we had briefed by the minister about 2 weeks ago and the agencies to know how prepared we are, because Nigeria, based on our population, based on our mobility and the economic activities, we have a high index of suspicion that it's only a matter of time before we have a case, because we are part of the global community. So I think based on that preparedness, that's why we are able to identify and diagnose early this index case. And as the minister stated, because the person is a middle-aged guy, the symptoms are mild, we are very hopeful that he will fully recover. And the containment actions will be effective enough to prevent spread. I also want to join the minister that Nigeria should not be panicked. I think we should be calm and just be vigilant and take the basic hygienic conditions. I watched the Minister of State this morning on your program. Just as he stated, we don't need to go in panic mode to buy masks or start wearing masks all over the places. In fact, the ordinary mask don't prevent the virus from being transmitted. There are special masks that can do that. So as such, and besides, the virus is not just in the environment. You have to be in touch with or in contact with secretions from an infected person. So this is what I want to advise.
All right. I must quickly add that because we know some lawmakers rejected rescuing Nigerians that perhaps were stranded in China, but at least are we monitoring Nigerians' welfare in some of these countries, where it appears that the virus permeates? And also, how much confidence do you have with regards to our airport screening, seeing as this confirmed index case came in to the country undetected?
No. I must say that the epidemiology, or that's the science of the disease, except the case may not be detected at the point of entry. What the screening at the airport is supposed to detect is somebody that is currently carrying infection, who has fever, because what the screening is doing is just to identify a person whose temperature is higher than normal. And as we know, you may be incubating the disease and not in the stage of manifestation yet, as at the time you enter, which is what happened with the index case. So it doesn't mean it's a failure of the testing. The testing we identify at the port of entry for a person who is infected, that is having an high temperature. And that is the only one that the testing can detect. But as we know, based on the epidemiology of this disease, you can be incubating and you can still transmitting from while you're incubating. So we cannot blame the fact that he was not. As at the time he entered Nigeria, he wasn't sick. He has not started to demonstrate the symptoms of disease. That's why he was not identified at the airport. But within the 48 hours after entering, he developed temperature. And you could see that in less than 48 hours after that, based on the alertness of the health workers, he was identified, he was diagnosed, and confirmation was done in less than 24 hours. That shows that at least the preparedness we had is effective.
According to health experts, one's prognosis also depends on the treatment you get, which in turn depends on what is available and the stage of the epidemic. But as our healthcare systems in Nigeria stand today, if the epidemic takes off, we don't want it to, but if it does, can we handle it, seeing how much we have budgeted for health in the past?
Well, I think I would say we should be able to handle. We hope and pray vehemently as Nigerians that it doesn't spread for us to have large number of cases. If it does happen, of course, the current health budget may not be able to accommodate that. But if it's an emergency, it means we have to, just like any other emergency, there are what we call contingency fund in the budget. But I'm a member of the National Assembly. I'm aware that we have some contingency funds, which we call within the service-wide vote, that can attend to any kind of emergency, including this one, because emergencies may not necessarily be health alone. There are other emergencies that could occur that the country will have to be called upon, which will not be in the regular budget. But straight to your point, the current health budget may not handle if we have a broader emergencies, but we'll be able to lean towards other sources of income. But I must add that what we do have now in the budget for emergency is from the Basic Healthcare Provision Fund, where we have 5% of that set aside to address emergencies. The Basic Health Provision Fund has a total of 44.5 billion naira allocated. 5% of that is for emergency. That is the only thing we have as far as budgeting is concerned for emergencies in health. But beyond that, if it is beyond what that can cope with, as I said, we have to look at other sources of fund from the contingency fund.
All right, we'd like to thank you, the Senate Committee Chairman on Health, Dr. Ibrahim Oluriegbe. Many thanks for joining us at this time on Lunchtime Politics.
Thank you very much. It's my pleasure.